Thank you, Brenda. Good morning. Good morning. It's a real pleasure to be here. I think my remarks will echo a number of Brenda's remarks about shared value. I have to say, when Michael Porter and I started writing about shared value 5 years ago or so, we really had no idea what we were getting into. The topic keeps growing. And it keeps growing in two ways. It keeps growing in terms of the global momentum. I've just recently been speaking in Hong Kong, we've had groups going in Japan, we've had groups going in Australia, we've had a session going in Iceland, we've had sessions going in Africa. This idea of creating shared value has gained global attention and continues to build momentum for companies around the world. And that is certainly more than we ever anticipated. But it also keeps growing in terms of the complexity of what it means to really embrace shared value. The more we are researching this, the more we are developing business school teaching cases to teach at Harvard and elsewhere, the more we are working with companies, the more we find that it is not simple to really embrace this idea of creating shared value. And the more we're finding that shared value is really about two things. It's about innovation and it's about strategy. It's about innovation because to meet the needs of markets that we have not sold to before, to operate business in a way that is truly aligned with the needs of society is actually a very different exercise. It's not just extending what we're already doing into new markets. It's not just expanding or changing our philanthropy program. It's really reinventing the business we're in. And so there are wonderful examples out there. There's a company called Vision Spring that has developed a new approach to thinking about eyeglasses. Because when you or I get eyeglasses, we go to the optometrist or optician, and we get a prescription, and then we go have it filled. Well, for billions of people in the world, there is no access to optometrists. And so a very clever person at Vision Spring said, you know what, we could take two lenses that are mirror images of each other and have a little dial on the side. And as you slide them back and forth, they go from no prescription to a very strong prescription. So you don't need an optometrist, you just turn the dial until you can see. And all of a sudden, there's a market of 700 million people for eyeglasses who can now earn a living and lead a fuller life because they can see, that didn't exist before because we're so used to designing our business models for the existing infrastructure of the developed world and for the level of wealth and education of our traditional customers. And to go beyond that takes a different way of thinking. It really takes innovation. And again, there's so many interesting examples. There is a cell phone company in Africa that said, you know, it would be great if we could offer life insurance to low-income populations. Because when someone dies, the costs of the funeral, the cost to the family are significant. And even if in our minds it's very small, a couple $100s, that can be transformative to a family. But how do you offer insurance, which is a very complicated concept, to someone who has no experience of it? And how do you sell it to a large enough population that you don't have adverse selection, so only people who are sick buy it? And they came up with a very interesting idea. They said, if you sign up for our cell phone program, we'll put a small surcharge on the minutes. And depending on how many minutes you use a month, that's how much life insurance you have. And all you have to do is sign up at the beginning, register yourself or your family, and then if you provide a death certificate, you'll get paid the insurance premium. There are 135 million people in Africa who have life insurance through their cell phone plan. Again, these are all just examples of how different it is to really meet the needs of low-income consumers in a way that makes a viable economic model. And that's what shared value is about. But shared value, as I said, is also about strategy. And we're seeing companies rethink the business that they're in. You'll hear later today from Derek Yock, who's involved with Discovery, a health insurance company that has really reinvented what insurance means by developing a very sophisticated set of incentives that actually lead their members to engage in healthier behaviors, with the result that their healthcare costs are lower and their life expectancy is longer, according to a study done by Johns Hopkins. And that means that they're actually a more profitable life insurance company. We've just been doing some work with Nestle. And of course, the food and beverage industry is in a bit of crisis as people are moving toward healthier foods, as the burden of obesity on one hand and malnutrition on the other is something that they are beginning to be held accountable for. Well, Nestle has said, you know what, instead of being a food and beverage company, we want to be a nutrition, health, and wellness company. And we actually have to do the research. We have to do the clinical trials to understand when nutritional supplements can improve health outcomes. And so they've discovered that most patients in the hospital are undernourished. And when your immune system is compromised, you need specific supplements to compensate for that. So they've developed a nutritional formula, which if you take it 5 days before and 5 days after surgery, reduces post-clinical infection by 52%. They've developed other formulas that reduce epilepsy attacks for drug-resistant epilepsy by up to 90%, that have an impact on depression, that have an impact on other diseases. They are actually creating a new industry that is midway between food and pharmaceuticals, which they see is the growth area for their company for the future. They've reinvented their industry because they've begun to take seriously this idea of creating shared value. There's another company, a fertilizer company called Yara, which I think is a very interesting example. It's a Norwegian company, one of the largest sellers of fertilizer in the world. And they work with small farmers, smallholder farmers all over the world, and they wanted to work in Africa, in Tanzania, where many of the farmers inland have no access to the ports. And that means Yara can't sell fertilizer to them, and it means they also can't sell their product to the global markets. So Yara decided that they could help lead the creation of an agricultural corridor that extended from the port through the richest farmland of Tanzania all the way to the far border. They had to engage 300 different companies and organizations, from competitors to other businesses to development agencies and the World Bank, in order to put together all of the pieces that were necessary, because bringing the food to the port doesn't do any good unless you have refrigeration. Well, you can't have refrigeration unless you have electricity, and you need trains, and you need roads, and you need a whole network of things that are fit together like puzzle pieces. And it turns out that no one element alone would be sufficient to solve the problem. And it's really interesting to step back and say, why didn't government do this? And of course, there are a lot of constraints on government. And government is not necessarily responsive to the needs of the poorest people in their country. Government is not necessarily looking to the future. Government is not necessarily able to assemble all of the different players and exert the kind of leadership that was necessary to build this coalition and make it actually happen in practice. It turns out that is a role that companies can play in a very powerful way. So we're seeing companies rethink the business they're in. And we're also seeing NGOs, development agencies, governments rethink the role of business. Because for a long time, the assumption was business is the problem. Business is doing evil things, bad things, is taking away from the population, is extorting. And so if we're really going to help people, we have to work through the NGO sector. We have to work through government. We can't trust business. Well, it turns out you can't get a sustainable, scalable solution without engaging business. And even more than that, it turns out business has the innovative capacity to come up with solutions that NGOs and government aren't able to come up with. And it's because of the competitive pressures that business is under. It's because of the scale of resources that business has. When GE decided through their Healthy Imagination program that they wanted to create new products that enabled people around the world who didn't have access to traditional hospitals to have access to healthcare devices and products, they committed billions of dollars to the research and development effort. They would never have committed billions of dollars to philanthropy. Their shareholders wouldn't have let them. And there are very few NGOs, if any, and actually not that many governments, that have the freedom to commit billions of dollars to research and development like this. So engaging business brings resources, but more than that, it brings innovation and creativity and scale. You know, I mentioned Nestle. Another dimension of what they're doing is micronutrient fortification. And they discovered, working with the World Health Organization, specific nutritional deficiencies, first in West Africa, then in other parts of Africa and Latin America and India. And they developed specific products that were affordable to low-income populations, that were used on a consistent weekly basis by families, that could absorb the micronutrients and distribute them, be sold profitably. They're selling almost 200 billion servings a year. That is a tremendous scale and impact. And it's interesting to contrast that with a project that Danone did with Mohammed Yunus, the Nobel Prize winner for microfinance leadership, that involved trying to develop micronutrient fortified yogurts that was based on a social enterprise model, a company that would generate revenue and income but would not distribute profit. It would be a fairer company, in a sense, in that any surplus would simply be reinvested in the business and its mission. And it was a successful venture, and they've been able to distribute about 36 million cups of this nutritional fortified yogurt a year, but they weren't able to scale it beyond a single factory. Because it turns out that actually having profit, having that incentive, having the access to finance and capital that gives you, is essential to reach the scale. And so I look at what Grameen and Danone and Mohammed Yunus have been able to do without profit, which is good and engaging business. But then I look at 200 billion servings a year that Nestle has been able to generate with a profit motive and say, you know, this is very important. So shared value is a different way of thinking about engaging business in solving social problems. But it also requires business to think differently. It requires companies to honestly admit to themselves that they have to align their own success and growth with the interests of society. That's kind of new thinking. Certainly is new thinking at Volkswagen. But it's new thinking at a lot of companies who developed, through no fault of their own, their business model and their products at a time when we didn't think this way, when we didn't pay attention to the health consequences of activities, when we didn't realize that so much of health outcomes is determined by behavior, by socioeconomic conditions, by lifestyle, by diet, by the physical environment. I think every company in the world is in the healthcare business because, as Rebecca mentioned, and as Brenda mentioned, they have their own employees' health to be concerned about. But even more than that, because we realize almost everything we do each day has an impact on our health. Every product we use, the environment we live in. And so virtually every company has a degree of impact on our health outcomes. That's true in developed world, and that's true in emerging markets. I think that Shared value also requires a mindset shift on the part of aid agencies and governments around the world to look closely at their policies and try and understand if their policies are encouraging shared value. We talk very easily about public-private partnerships, but most of them, I think, come down to writing a check. And that's not a very creative example of strategy and innovation. That's not a great example of creating shared value. To go beyond that, you really need to understand your policies. I was in India just a couple weeks ago where we launched the Shared Value India project. And the government in India has passed interesting legislation a couple of years ago that requires every company to spend 2% of their profits on CSR. And they struggled as to how to define this in a way that would be easy to understand. And so they said, well, the real definition is if you're spending it in any way that benefits your own employees or your company, then it doesn't count, because we want to be for the public good. Well, one company that we have actually worked with there, turns out they have a program feeding their employees a free breakfast, because it turns out their employees can't really afford 3 meals a day. And they said, actually, I think we have to cut this program because it doesn't qualify under the new policy. The alternative, of course, would be perhaps to pay your employees enough so they can afford 3 meals a day, but somehow that didn't occur to them. The last point I'll mention, because I really want to make this a discussion and have time for question and answer and conversation, is about the idea of really understanding that the people we thought of as beneficiaries are now customers through a shared value lens. And that means you really have to do customer research to understand the needs and wants of the people you're trying to serve and sell to. There are so many ideas that I see in philanthropy and global development that are wonderful ideas that would be terrific for people to do. Just turns out people don't want to do them. And so they don't work. Business, of course, when it approaches these things through a shared value lens, says if people don't want it, I can't sell it, and then it's a failure. So the shared value lens of business immediately makes you obligated to focus on what people actually want and will use, not on what's good for them. And that, too, is a really interesting shift. And so we're seeing market research being done, for example, by low-income populations in India. And we're finding really surprising answers, that the things that when we sit in a foundation boardroom or a corporate boardroom, we think people obviously ought to want, turns out is not necessarily what they want. That the things that are good for them aren't necessarily meeting their immediate needs and pressures. And so again, it is a shift in thinking to say it isn't just about finding solutions that sound good, it is about treating the beneficiaries as customers and doing the research to really understand what it takes to meet their needs in a way that people want them to be met. So, as I say, the more we work with companies, the more I meet companies and talk with companies around the world, and governments and NGOs, the more I realize that this shared value idea that Michael and I had 5 years ago is not a simple idea. It really requires profound changes in thinking by companies about what their strategy is, what their source of competitive advantage, what choices they make about how and where to compete, and about the decisions that government and NGOs make in terms of the policies they create and the ways in which they work with companies. But what is so exciting is that when we see shared value take hold, the scale of impact, the leverage that can be achieved is phenomenal. And so I have come to believe that while shared value is hard work, that the mindset shift it requires is not easy, that it is very much worth the effort, and that we can make progress on the issues of global health and poverty and other issues that the world has grappled with for centuries, that we can make more progress in the coming decades than we have for centuries by really finding this new model, this new way for business and society to begin to work together. Thank you very much for letting me be here with you.